Bulimia nervosa, commonly called bulimia, is a serious, potentially life-threatening eating disorder. People with bulimia may secretly binge eating a large amount of food with loss of control over the eating and then purge, trying to get rid of the extra calories in an unhealthy way. To, to get rid of calories and prevent weight gain, people with bulimia may use different methods. If you have bulimia, you are probably preoccupied with your weight and body shape. You may judge yourself severely and harshly for your self-perceived flaws. Because it's related to self-image and not just about food, bulimia can be hard to overcome, but effective treatment can help you feel better about yourself, adopt healthier eating patterns, and reverse serious complications. By definition, it is characterized by frequent binge eating and purging and a self-image that is unduly influenced by weight, of course. There are existing two types of bulimia, like purging and not purging. Purging is a type with self-induced vomiting or the use of laxative diuretics or enemas. Non-purging type is with fasting or exercise, but not purging during bulimic episodes. Symptoms. There are many symptoms that are characterized to bulimia nervosa, like being preoccupied with your body shape and weight, living with fear of gaining weight, repeated episodes of eating abnormal large amount of food in one sitting, feeling a loss of control during binging, like you cannot stop eating or cannot control what you eat, forcing yourself to vomit or exercise too much to keep from gaining weight after binging, using methods like laxatives, diuretics, or enemas after eating when you are trying when there is no need, fasting, restricting calories, or avoiding certain foods between binges, using dietary supplements or herbal products excessively for weight loss. So the severity of bulimia is determined by the number of times a week that you purge, and usually at least one time per week and for at least 3 months are enough for establishing diagnosis if you are doing this purging. Red flags. Because most people with bulimia are usually normal weight or slightly overweight, it may not be apparent to others that something is wrong with you. Red flags that family and friends may notice because they are in interaction often with you may notice. Constantly worrying or complaining about being fat, having a distorted, excessively negative body image, repeatedly eating unusually large quantities of food in one sitting, especially foods the person would normally avoid, strict dieting or fasting after binge eating, not wanting to eat in public or in front of others, going to bathrooms right after eating, and provoking vomiting, exercising too much, having sores, scars or calluses on the knuckles of the hands, on the dorsum, having damaged teeth and gums, changing weight, swelling in the hands and feet from edema, facial and cheek swelling from enlarged glands, especially parotid gland. Do exist any of the risk factors for bulimia nervosa? Of course, girls and women are more likely to have bulimia than boys and men are. Bulimia are often was beginning in the late teens or early childhood, and factors that increase risk of bulimia are classified in this way, like biology, psychological, and emotional issues, and dieting. Biology: people with third-degree relatives like siblings, parents, or children with an eating disorder may be more likely to develop eating disorder. Psychological and emotional issues: psychological and emotional problems such as depression, anxiety disorder, or substance abuse are closely linked with eating disorder. People with bulimia may feel negatively about themselves. In some cases, traumatic event and/or environmental stress may be contributing factors. Dieting: people who diet are at higher risk for developing eating disorders. Many people with bulimia severely restrict calories intake and between binge episodes, which may trigger an urge to again binge eat and then purge. Complications: bulimia may cause numerous serious and even life-threatening complications, and possible ones include negative self-esteem and problems with relationships and social functioning, dehydration, which can lead to major medical problems such as kidney failure, heart problems such as irregular heartbeat or heart failure, severe tooth decay and gum disease, absence or irregular periods of females, digestive problems, anxiety, depression, personality disorders, misuse of alcohol or drugs or substance abuse, self-injury, suicidal thoughts, or even suicide. Can we prevent any of the ways? So, there is no sure way to prevent bulimia. You can steer someone toward healthier behavior or professional treatment before the situation worsens. Here's how you can help: foster and reinforce a healthy body image in your children, no matter what their size or shape. Help them build confidence in a way other than their appearance. Have regular, enjoyable family meals. Avoid talking about weight at home. Focus instead on having a healthy lifestyle. Discourage any type of dieting. Talk with your primary care provider. And if you notice a relative or friend who seems to have food issues that could lead to or indicate an eating disorder, consider supportively talking to the person about these issues and ask how you can help him or she. Treatment: when you have bulimia, you may need several types of treatment. Also, combining psychotherapy with antidepressants may be the most effective for overcoming the disorder. Treatment generally involves a team approach that includes patient, family of the patient, primary care provider, mental health professional, and a dietitian experienced in treating eating disorders. Psychotherapy, also known as talk therapy or psychological counseling, involving discussing bulimia and related issues with a mental health professional. Evidence indicates that these types of psychotherapy help improve symptoms of bulimia. So, cognitive therapy, behavioral therapy, family-based treatment, and interpersonal psychotherapy are many of the types of talk therapy. So, cognitive behavioral therapy help you normalize your eating patterns and identify unhealthy negative beliefs and behavior and replace with a healthy positive ones. Family-based treatment to help parents intervene to stop their teenagers' unhealthy eating behaviors, to help the teen regain control over his or her eating and help the family deal with problem that bulimia can have on the teen's development and the family. Interpersonal psychotherapy, which addresses difficulties in your close relationship, helping to get more communication or improve your communication and problem-solving skills. Medications: antidepressants may help reduce symptoms of bulimia when used along with psychotherapy. The only antidepressant approved by Food and Drug Administration Organization (FDA) is to treat bulimia is fluoxetine or Prozac. It is an SSRI, a type of SSRI that specifically may help even if the patient do not have depression. Nutrition education. Dietitians can design an eating plan to help you achieve healthy eating habits to avoid hunger and craving and provide a good nutrition. Eating regularly and not restricting your food is important in overcoming bulimia. And the last line is hospitalization. Bulimia can usually be treated outside of the hospital, but if symptoms are severe with serious health complications, patient may need treatment in hospital. So hospitalization. And of course, coping and support. You may find it difficult to cope with bulimia when you are hit with mixed messages by the media, culture, coaches, family, and maybe your own friends or peers. So how do you cope with the disease? There are many points, like remind yourself what a healthy weight is for your body, ideal or at least normal. Resist the urge to diet or skip meals, which can trigger binge eating. Don't visit websites that advocate or glorify eating disorders. Identify troublesome situations that trigger, so avoid trigger situations or thoughts. Have a plan in place to cope with the emotional distress of setbacks. Look for positive role models who can help boost your self-esteem. You can also find pleasurable activities or hobbies that can help distract you from thoughts about binging and purging, and even any diet. Build up your self-esteem for giving yourself, focusing on the positive and giving yourself credits and encouragement. So this can help if you have a desire, of course, also. Thank you very much for your attention. Hope this video is useful for you. If it is, you can subscribe and follow with next and new videos. Have a great time, guys.